Martin, Louisa, come on through.
Hello, Dr. Ryder.
Please call me Emma. I like to keep things informal.
Thank you.
I read your study on follicular fluid concentrations.
One of the few. What did you think?
I thought it was very interesting.
Thank you.
Did you receive the anti-malarian test results I sent you?
Yes, I did, yes.
And they show that I have a low ovarian reserve, don't they?
Yes, but a single test isn't definitive. And we will need to repeat them on your next cycle to compare results.
Is there a chance it'll be any better?
It's not unheard of for your hormone levels to fluctuate. 9 times out of 10, the complication lies with the female. Oh, but I will also need a sample of your sperm.
Yes, of course. Yeah.
Now, before we proceed, I need to check that you're both prepared. Fertility treatment can be emotionally fraught.
Yes.
And there are no guarantees.
Absolutely. We don't want to delay, because if there are any problems, I'd rather know sooner rather than later, yeah.
If there is a problem with ovulation, we can look at some treatments. Medications like clomiphene.
Or what does that do?
It stimulates ovulation.
And it's also very important to try and stay relaxed. A common cause of ovulation problems is stress. I will need to see you again in 2 days, so we can align the blood tests with your cycle. I'll also be performing an ultrasound. And yes, Dr. Ellingham, I do realize that you could perform the ultrasound, but your job here is to be emotionally supportive. And I believe you have an ovulation chart for me.
Yes. Yep.
Thank you.
Thought it was you. Joe Penhale. We're at school together. You probably don't remember me.
G.I. Joe! Of course! How you doing?
Well, it's PC Joseph Penhale now.
You look great. You've become the man.
You hear about the vandalism, then?
Did they take anything?
No, just the fencing, probably for firewood.
It's pretty uncool not to respect other people's property. Any idea who did it?
Probably teens mucking around. Not much chance of finding out who did it unless you've got CCTV of the incident.
No.
Do you think they'll come back?
It's worth getting some cameras to deter them. Your security's pretty low spec, to be honest.
Well, I guess we'll do that, then. You got the keys?
So what you been up to since school?
Just living the life. Went traveling, Indo, Oz, all over, really. Riding waves, experiencing other cultures.
Nice.
Now I met that beautiful girl. We swung back here for our next adventure. What about you?
Yeah, pretty much the same.
Yeah.
Yes. After Weybridge, I moved to Delabole. Got restless, you know, had the wanderlust, and ended up in Port Wen.
So you wandered about 8 miles?
Not really the distance, it's more the experiences along the way.
Ah, that's beautiful.
Thank you.
Nathan, we gotta go.
She's got a checkup. Women, they're amazing, aren't they? What they go through.
Right, I'll come back after lunch. We can talk through security options.
All right, brother. Sounds good.
Doc, just to warn you, I got my beeper
You beep?
for first aid emergencies, so this goes off, I go running.
No, you need to inform me first.
It's my beeper, and I'm the first aid responder.
Then I'm your employer. I'll see you shortly.
All right, Paul?
All right. Is Louisa about?
Louisa? Yeah?
Paul!
Hiya. I got your message about painting a room.
I couldn't get hold of you.
Oh, yeah, I dropped my phone. Smashed it. I'm all right, butterfingers. Just got a new one.
Well, I couldn't find anyone else, and it really needs to be done today because I'm using that room tomorrow.
Yeah, of course, yeah.
Come this way.
Margaret Fowler.
That's
It's all right if Nathan sits in, isn't it? It's just as we get close to the due date, I really want him to keep involved.
Yep, it's fine. Take a seat, roll up your sleeve.
Yeah.
It's a miracle, isn't it, Doc?
I've been trying to relax more, like you said. I've stopped surfing and instructing.
Stop talking.
The way I see it, Doc, this is one of them moments you just gotta let nature take her course. I mean, women have been giving birth for centuries.
They've also been dying in childbirth for centuries. How are you feeling?
Yeah, a bit of heartburn.
It's to be expected at 37 weeks. Any headaches?
Maybe one or two, but no big ones. I didn't think I'd be a worrier, but I am.
What's wrong with your ear?
Oh, nothing especially.
He's got a surfer's ear.
Most people who surf get it. Comes with the territory.
Yeah, but tell him it's getting worse, though.
I'm not the patient here.
Make an appointment. We should continue to monitor you. Your last test showed the presence of protein in your urine, and you're at risk of developing preeclampsia, which can be very serious. It affects the blood supply to the unborn child.
The key words being can be.
It can also increase the risk of a stroke.
Again, can being the word, love. It's not exactly likely, is it, Doc?
It would be idiotic to ignore the possibility of complications, so I'll keep monitoring you, and if needs be, I'll hospitalize you. Do you understand?
Yeah.
You'll be all right, Muffin.
Everything all right?
Absolutely. Just taking some new stock in. Nothing to concern yourself with.
Actually, I was thinking I need to get more of a feel for how this place operates.
You already know how it operates.
Only as a barmaid, or bar person, or whatever it is they call them nowadays. So, we'll need to mix up the shifts this week. Bert, you'll be hands-on here with me. And Al, you can work up at the shop.
The shop.
Someone needs to take care of it, whilst I spend more time in the pub.
But I'm the pub manager. I work here in the pub.
It's just for a week. Think of it as a break from the pub.
Well, when you put it like that, it doesn't seem too bad. But just for a week, though.
No, I'm sorry. Al needs to be here because of the thing.
What thing?
Al, you tell her.
I don't know what you're talking about.
Yes, you do. The thing. The thing which means he can't leave the pub.
It can't have been that important if neither of you can remember it. So, that's settled then.
Thank you. Right, you can do this lot.
Just need to get some more paint from the van.
Here we are. It's a little bit cramped.
It's fine. You say cramped, I say cosy.
So, what's my first client like?
Oh, a couple of behavioural issues at school, anger management mainly. They don't want to exclude her though, so she was referred to me.
Do you think I'll be able to handle her?
She's a great starter case. And if the supervised session goes well, you could possibly start seeing her more regularly.
You okay?
Sorry, a bit of back pain. Maybe sciatica.
You should see Martin.
No, I don't want to bother him.
Bother me about what?
Were you eavesdropping?
No, I was on my way to the kitchen. What's wrong with you?
As I was saying to Louise, I'm concerned I might be getting sciatica.
Come through to the consulting room.
I can't stay. I've got to rush off straight after this.
I'll make an appointment when you've time. Meanwhile, elevate your knees, apply warmth, and use a muscle relaxant. Or sit on a tennis ball.
Oh, okay. Thanks.
Louisa, I hope your patients aren't going to obstruct the business of the surgery.
We call them clients, not patients.
I'll make sure they stay out of your way. Hardly taking up a lot of space, Martin.
Yes.
Mrs. Tishel?
Oh, just coming, Doc.
Martin, I thought it was you. I was just on my way to see you.
I'm not doing any more pretend consultations. That was a complete farce. A waste of your time and mine.
No, it wasn't a waste of my time. I was doing my job. But you can turn that frown upside down. I'm not here on GMC business. I'm down visiting family.
Do you want me to ask him to leave, Doc?
No. I have some medical supplies to collect, though.
Actually, I was looking for a second opinion about a medical matter.
Well, with me?
Yes.
Make an appointment.
You've got a heart of gold, Doc. Some people would see a man like that torn and feathered, dragged through the streets.
The medical supplies.
I'll see you later, Martin.
Medical supplies.
Bought you some padlocks. Had some lying around the station. It's marine grade, closed shackle, hardened steel. It's an absolute beauty.
You're like super fond of locks.
I wouldn't say fond. It's an interest. You thought any more about cameras?
Yeah, I don't know those. All a bit big brother, eyes on everyone.
Teenagers driven by hormones and boredom to vandalize your property. They see a camera, they'll keep away. Trust me on it. I've done courses.
Cheers, brother. Here, how about a free surf lesson for your trouble?
I don't think so. I've not been on one of those before. It's not really my thing.
Sure. I think it's exactly your kind of thing. Out there, it's just you and the waves. She'll take more from you than you think you can give. But that's when you find out who you really are. You're the padlock. The ocean, she's the key.
Okay, sounds great. I'm free tomorrow morning.
We ride at dawn. Meek at 10 o'clock, that's when I open.
No. What are you doing? Put your shirt back on.
Oh, sorry, Doc. I got a bit hot. I always carry a couple of fresh ones with me in case I need a change.
Well, this isn't a changing room. Have you showered today?
Of course.
Show me your hands. Lift up your arms. Oh, yes. Hyperhidrosis. Put them down. Excessive perspiration.
I sweat a bit. Yeah, it's normal for a bloke.
No, it's not. You're sweating profusely and your body odour is appalling.
It's a bit offensive, that is.
It can be treated.
What kind of treatment?
Shave the appropriate area and inject your sweat glands with Botox.
I don't want Botox. I'm not some middle-aged woman.
It's a very small amount. It blocks the neurotransmitter that stimulates the sweat glands and paralyzes them.
Yeah, that sounds awful.
It's completely safe, and it would really help you. Did you say you had a spare shirt?
Yeah.
Well, change into it. Not here in the lavatory.
Where's the bathroom?
Dr. Mullen,
Hello.
the doc didn't mention anything about another assessment.
No. I'm here in a private matter.
Right. Gotcha. Hello, do you have an appointment?
No.
Is it an emergency?
No.
Are you sure?
Yes. I'm sorry, what are we doing here?
Are you asking me for real, or is it still part of the thingy?
Thingy?
Role play. You come in pretending to be a real patient and whoops, heart attack.
No. I want an appointment, for real.
Are you sure?
Yes.
Sorry. First thing tomorrow's best I can do.
Well, it'll have to do.
I still feel like this is some sort of test.
No, it isn't. Really.
If it was a test, how did I do?
You did great.
Did you remember to stop taking the antihistamine 3 days ago?
I did.
Good. That can affect the result. If you have an allergic reaction to any of these allergens, then the site will become swollen and slightly wide.
How's Louisa after the whole slightly manic playdate episode?
She's fine, thank you.
Well, that's good to know. She seemed quite emotional.
It's a side effect of the adrenaline, I think. Well, you're having a very quick reaction. It can take up to 10 minutes.
Oh, yes. It does look quite severe, doesn't it?
And you have more than 3 reactors, which confirms that you are atopic.
I knew it. I've been looking it up online. It says that stress causes histamines to be released into the bloodstream that can increase allergic reactions.
That is correct, but you shouldn't look these things up on the internet.
Oh. Well, maybe that's why I've been feeling so run down.
It's unlikely. I'll take a blood sample, run some further tests on it, see what's going on.
Is it stress that causes your blood issue? Ow!
Make an appointment with the receptionist. I'll have your results tomorrow.
It's fairly self-explanatory. The only real thing to look out for is if they're too soft, like this here. Into the box it goes.
Seems like a waste. Some of the stuff's still edible.
I hate to throw good produce away, but I can't shift old fruit and veg. Now, what else do you need to know?
Well, this is only for a week, yeah?
I imagine so.
It's not a very reassuring answer.
Does your father have a fancy woman?
No.
Ripe or not?
Still firm, so still ripe.
Have that on my tombstone.
I'm still the manager of the pub, though, yeah?
Of course. Life is like a napkin. Sometimes you just need to fold it differently to see what the outcome is.
So if I had any ideas or innovation?
Yes, of course. Now go on. Chop, chop. Off to work.
Oh.
I wouldn't have come otherwise, but Mags insisted. With a baby coming, she's become a bit of a worrier. I'm wasting your time, really.
You have exostosis, so a bony spur growing on an existing bone, and a nasty ear infection.
Yeah, I know. I've been treating it with hydrogen peroxide and isopropyl alcohol mixed 3 to 1.
That's not a medically endorsed treatment.
Well, I endorse it. Works for me.
You need antibiotics and you need to keep it dry. If it gets wet, then the wax and the water can't escape the ear canal because of the blockage.
Yeah, with bony growths, I know. Most of my mates have got surfers here. But I have to go in the water. Society's deemed we need money to live, so I have to teach to earn some.
You realise if you don't take this seriously, you run the risk of losing your hearing permanently.
And if I don't pay my rent, I run the risk of losing my home permanently.
Have you tried earplugs? Earplugs?
Yeah, kept losing.
Right, well, I can write you a prescription for some antibiotics, but I would recommend surgery. Would you like me to refer you to an ENT specialist?
What are they gonna do?
Remove the obstructing bone growths with a drill.
Yeah, when I go in the water, the bone will grow back again. We'll be back to square one. I'll leave it, thanks.
All right, well, that is my medical advice.
Let me take you out on the waves. Work off some of that tension. Won't charge you. Call it my civic duty.
No.
All right. But sometimes even a physician needs some healing. Hmm? Don't overdo it. I'll finish it off later.
Look, I'm sorry we got off on the wrong foot before.
We didn't. You conducted a pantomime and you made me take part in it.
As per GMC requirements. I'm the man they call when they want an assessment, and I suppose I do.
What are you doing here, Dr. Mullin?
Sorry. Straight to the point. Good. Pain in my legs, some numbness across the lower back. I've been to a few doctors. The last one diagnosed spinal stenosis, said I'd need surgery.
It's a drastic conclusion.
That's what I thought. That's why I came to you. I mean, I'd rather not go under the knife. My boys are 10. I'd like to kick a ball around with them. I know it's a cliche to say they grow up fast, but they really do. Sebastian, this last couple of years, growth spurt's been amazing. Sorry. So I've been taking tramadol for the pain, but I thought if anybody can come up with an alternative
How's the
solution...
examination table? When did you first notice the symptoms?
Well, a few months, on and off, but it's got worse lately.
Lie back, raise your legs 90 degrees. Describe the pain.
Painful. Sorry. Starts in the feet and calves, moves up towards the back and the backside.
Your femoral pulse is weak. I'll scan your arteries. Do you smoke?
Used to. Pack a day. Gave up when the boys were born. So, 10 years now since.
Cholesterol?
High.
Impotence?
Is that relevant?
Of course it's relevant. Why do you think I'm asking you?
I don't know. Maybe it's your way of making polite conversation.
Do you suffer from impotence?
Yes, sometimes. But more than I'd like.
It's not spinal stenosis. You have peripheral artery disease. Your pain and your impotence are caused by a diminished blood supply, which is due to an accumulation of cholesterol plaques in your arteries.
That is amazing. I have been to 3 doctors. Not one of them thought to check my femoral pulse.
I'll prescribe you a high dose of atorvastatin. That should shrink the blockage, and that'll ease your symptoms.
We mustn't let the GMC fire you.
Why? Are they going to fire me?
No. Well, no firm decision has been made yet, but I'd say the prognosis isn't good. There is a way through this. If you'll just be more compliant with the GMC.
I have been compliant.
Martin, only you can change the outcome. But if you change your mind, I can't help.
Huh? Right, boy?
Yeah.
What are you doing?
Setting up a pop-up stall.
Pop-up?
Yeah, here today, maybe gone tomorrow. Specialising in street food.
Now, have you run this by Caitlin? Because she's not a big fan of independent thinking, you know.
Well, she left me in charge, so I'm using my discretion.
I can't help thinking that you'd be better up in the pub. You're safety in numbers.
Oh, it's only for a week. And to be honest, Dad, it's quite nice to have a change of scenery. Guacamole.
I'm here for the free Botox.
What are you talking about?
You're offering it to my boyfriend. He doesn't need it, but look at my forehead.
Oh, nothing wrong with it.
You were joking. Well, I want it smoother.
No.
You were giving it to him. Why can't I have it? That is sexist.
He needs it. He sweats excessively and he has severe body odour.
No, he does not.
What, you really can't smell him?
No.
He absolutely stinks. Do you ever have a blocked nose or nosebleeds?
Well, a few nosebleeds now and then.
Hay fever?
Yeah?
Get an examination table.
Hello.
All right.
Is Nathan around?
Nate, your mate's here.
All right. Must be great living like this. Free and easy.
I don't feel so free and easy at the moment. I'm ready to pop any second.
Joe.
Nate.
You got some nice waves this morning, brother. Could be offshore later. I'll get you aboard. Mags will get you a wetsuit.
Sorry?
Wetsuit for Joe.
Well, I'm quite comfortable where I am.
Okie dokie. Looks like I'll be getting you a wetsuit. We'll get the board after.
He's great, isn't he?
Nathan. Yeah, he's great.
You have a nasal polyp, a small tissue growth in your nasal cavity.
Ugh.
That's why you can't smell your boyfriend. Can you feel that?
Well, not really.
All right.
Will it hurt?
I'll spray this anesthetic up.
Oh, God. That is massive.
I'll prescribe you an antibiotic spray. Keep this gauze on for an hour, and you're not to blow your nose for 2 or 3 days.
Oh, what about my forehead?
Oh, that was so stupid.
Hi, Morwenna. We're here to see Louisa.
Louisa? Coming. Your patient's here.
Client, they don't have patients. They have clients.
Hi,
Hi, Bethany. Thanks for coming in today.
Well, it was this or getting excluded, so...
Okay, great. We're going to come through into my office.
Iona Castle. Go through.
It's a bit cosy. You sit here, Bethany. Now, Sam will obviously be observing, but he'll be assessing me, not you.
Is that because you're not qualified?
Well, I'm qualifying, but yes, you are actually my first patient.
A client.
Client, yeah, client. So, Bethany, I understand you sometimes have problems managing your anger.
No. Sometimes, whatever.
Yeah, well, today we're going to be talking about some coping strategies, okay?
Stinks of paint in here.
Yeah, I just wanted it to look nice for our first meeting, but yeah, it does smell a bit.
Just like we did on the beach. Paddle, 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 pop up one smooth movement.
Paddle, 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 pop. Got it.
Ready?
No.
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 To be honest with you, I've always been a little bit scared in the water.
Being scared's cool, brother. Makes us feel alive.
Tell that to the sharks.
Ready? Paddle, paddle, paddle. And here she blows! Come on! Front foot, middle of the board! Don't worry, everyone falls in first attempt. My bad, I probably shouldn't have pushed you in. You all right?
Cowabunga!
So, Bethany, what kind of things can we do to help ourselves keep calm? What's worked for you in the past?
I don't know. I set fire to my nan's shed.
You burnt your nan's shed?
Last time she got on my nerves, yeah. It made me feel better.
Why didn't you mention this before?
You never asked.
And that made you feel better? She hurt you, so she deserved to be hurt back.
Yeah, exactly. Thank you, Louisa. See, she gets it.
Yeah, but arson is a very serious crime.
Well, she is very gobby, my nan, so it was bound to happen.
And that's why you lashed out, because you felt like you'd been provoked?
Provoked, yeah. Exactly, she was basically asking for it.
OK, I think that's probably enough for today's session.
Yeah. She's actually way better than you.
I'm sure that's not true. Is there anything you'd like to discuss ahead of our next session?
All
right.
Go! I'm back.
I'll just go and see Martin. Hang on, I'll just get Martin.
Sorry, we need some help in here.
I'm with the patient.
Sorry, there's been a problem.
This is your back?
Yeah.
Must have gone into spasm. We need more space. Come with me. 2 steps down. That's it. Right, I'll lower you down here. Okay, back.
Is he gonna die?
Bethany.
Does that hurt?
Yes!
How about this?
Yes!
What's the matter with him?
He's got sciatica.
Ew.
Pain caused by compression of the root of the sciatic nerve in the lower back. Keep still.
Is he gonna be okay to drive me home then?
This is an anti-inflammatory. It won't be all right to drive for a while.
How long am I gonna be stuck here?
A couple of hours.
A couple of hours?
So sorry about that. There's nothing I could do.
Can't be helped.
Oh, hello.
Hello. Next patient, Dr. Julia Pope.
I just wanted to apologise about the whole playdate incident. It was, what a mess.
Maybe next time we should have your husband on standby.
I really don't think that would be necessary.
No, I was trying to make a joke.
No, I know.
Come through.
Okay,
Bye.
bye.
Your blood test showed that your immunoglobulin E level is high. I'll prescribe a different antihistamine, fexofenadine, 1 tablet a day, and an adrenaline pen, which you'll need to change every 6 months.
I'll try not to stab your wife with it.
I beg your pardon?
That sounded a lot differently to how I intended it.
Yeah. The tests also showed some abnormalities in your blood cells.
What does that mean?
You have macrocytosis, enlarged red blood cells. Are you a very heavy drinker?
No. Why should I start?
Macrocytosis is typically caused by excessive alcohol consumption or pernicious anemia.
Well, I must have pernicious anemia.
It's a vitamin B12 deficiency. Would explain your tiredness. Anybody else in your family suffer from it?
Not that I know of. Although we don't tend to sit around discussing our vitamin deficiencies.
It's a serious condition. It's treatable, though. I'll give you a B12 shot. You'll need an ongoing course of these for the foreseeable future.
Out of curiosity, does it affect my fertility?
It's a major cause of infertility. Once treated, though, you should be able to conceive. Are you trying for a baby?
I'm considering my options. Although I am missing something.
Yeah, what's that?
A man.
Take off your Mac.
Oh, what are you doing?
Street food.
I thought you ran the pub.
Well, I do, but Caitlin sent me here and, well, things escalated.
Oh, I can't keep up with you.
So, bendy carrot, wrinkled apple. Unsellable, right? But grate them into a bowl, toss them with some walnuts. What have you got?
A basic Waldorf salad.
Exactly. And I am breaking it in. It's given me a pretty good idea for a business, actually. Fresh and frugal.
Very alliterative.
You take nearly out of date, but still edible food, you turn it into street cuisine, and you serve it from a pop-up store.
So, life gives you avocado, you make guacamole.
Exactly. And the best bit about it, there's no real overheads. The stock is free, there's no rent, and I serve it from recyclable plates and cutlery.
Well, I think you're going to make a success of this business, Al. Even if it is by the law of averages.
No, yeah.
Oh, no, why not?
Is he giving you the pitch then?
Fresh and frugal, apparently.
I'll be here in a minute, Ruth.
You look like you're having fun.
Week after week, pouring the same drinks in the pub. It's nice to get a little bit more creative, Moana. How was your day?
I sent out the wedding invitations.
Right. So there's no going back then?
No. My beeper still hasn't gone off.
Well, stay positive. Pretty soon someone will have a heart attack or breathing difficulties or maybe even a seizure. So chin up, eh?
You know, the tests they do at the clinic tomorrow, they'll let us know if you've ovulated properly. I imagine after that she'll want to do an analysis of my sperm.
Hello.
That's disgusting, talking about stuff like that.
Sam still can't drive, so I said they could wait here.
I hope we're not in the way.
You know, one day I'd like to go to Hawaii, the home of surfing. Maybe catch a few waves.
Maybe this morning we could work on you getting up on the board without falling over.
You going out again?
I thought you were sleeping.
Well, no, I need some things picking up from the shops and the rubbish needs taken out.
No problem, I'm on it. As soon as we get back from surf.
Oh, it's like leaving the teenager.
Or I could do it now. Yeah, it's a good idea. Isn't it?
Oh, don't worry about it, it's okay. Sorry, I got heartburn. The best thing you could do now is give me some space.
You sure?
Yeah, go on.
Looking good, Joe?
Go away.
Doc, I was coming to see you. Hallie says she's going to break up with me. It was your fault, so you've got to Botox me.
Make an appointment.
I shave like you said and everything. Look.
All right, put your shirt down. Go into the surgery and wait for me. I have to take these to nursery.
Right, okay, Doc. Thanks.
Is this what you call taking care of the store? That's right. Someone told me what you were up to.
I'm able to do both jobs at once. And like you said, this produce was just going to waste.
I'm in charge, Al.
Yep.
You can't just do what you want anymore.
I understand that. I do. But the way I see it, when a napkin cannot be used as a napkin anymore, you can still dip it in soap and wipe the windows with it.
Trial run. Money goes in the till.
I take 60% of the cut.
50. And I'll do the napkins for your wedding gratis.
I can work with that.
She's doing my head in, boy. You gotta come back.
I don't know, Dad. Freedom, fresh air. It could be a while.
Come on. We have to open up.
Go on. Off you go.
What hurts worse? Armpits or hands or elsewhere?
I'm only injecting your armpits today. Your hands require a different type of treatment, using weak electrical currents on the skin. I'll refer you to a dermatologist for that. Other arm?
Well, if it's just my armpits, why did I have to shave all my hair off?
You didn't.
Oh. Well, I've shaved everywhere.
Put your shirt back on. Keep washing thoroughly. The injection should last between 6 and 12 months. The hair should grow back before then.
If I'm honest, Doc, I'm quite enjoying the smoothness.
Right.
Yeah, I might keep up with the manscaping. You know, in some areas.
You can go.
Get yourself ready for when it comes. Middle of the board, eyes over your shoulders so you can climb the wave. Hang on, I think there's something up my bags. Oh my God! Are you all right? Say that again. Are you all right? Ha! Actually feels better.
There you go. I do have a no mobile policy.
Doc, Max Fowler's gone into labour at Trewhenham Beach.
I'm 15 minutes away.
As first aid responder, I am therefore responding.
Sorry.
Come on.
Thank you, Dr. White. I will be in contact with the results.
Quickly.
Sorry.
We gotta go. We can't have it here.
I can't move. I think it's coming.
Doc's on his way.
We can still make it. I'm gonna get the car.
No, I don't think there's time.
Calm down, brother. Breathe in, relax.
Joe, this is real. I gotta get her to the hospital. I'm gonna get the car. I'm gonna turn it round.
Dude!
Nay!
Me, you all right?
Okay, you're all right. You're all right to move. Okay, wait for this one to pass. Okay, let's get you comfortable. You all right?
How's your wrist?
Oh, it's not good.
Here.
I don't want to concern anyone, but I think Nathan's wrist's broken and he's got blood and gunk coming out of his ear.
Joe, I have priorities. Okay, I just want you to focus on your breathing. All right? Now.
Are you qualified?
Okay.
She's done a first aid course.
I am a qualified first aid responder.
What, but you're not a doctor, you're a receptionist?
I have training.
Nay, please. I'm scared.
You'll be all right, Muffin.
Okay.
You heard what she said? She's qualified. You're in good hands.
Yes. Breathe.
How is she?
Her blood pressure's 150 over 100 and her fingers look a bit swollen.
Hello. I'm Louisa. I'm Martin's wife. I thought are you all right? I'm gonna have the baby now, aren't I?
Yes. The head's crowning. but your blood pressure concerns me.
Is that the preeclampsia?
Could be. Once the babies arrive, we'll deliver the placenta as soon as possible.
Oh, no, I don't want to have the baby in a search.
That's it. You're doing really
You
well.
don't have a choice, I'm afraid. Hot water and towels, please. What's happened to you? Has the pressure gone?
It has as it goes, but it's not important. Concentrate on Mag's, Doc.
What's the...
Harry!
Morwenna, can you bind his wrist and put a bandage on his ear, but don't put anything in it?
Okay, you'll be fine, don't worry.
Is that normal?
Just, okay, now, just, focus on your breathing, all right?
Am I going to be okay? You delivered my baby in a pub. Were you drinking?
No, I was in a taxi and the taxi crashed, so I had to go to the pub. It's a long story. The point is, he's very good.
Here we are, Doc.
Okay. Thank you. Yeah.
Mrs. Fowler,
Yeah.
I want you to push. Now. Push.
Push, Muffin.
All right, I can see the head. Stop pushing.
You're doing really well.
Is it a boy or a girl?
It's a head. Be quiet.
Oh, my God.
Just breathe. Doc.
Oh, don't worry. It's a perfectly normal reaction to the situation. Push again. I can see shoulders.
Nathan! Nathan! Where's Max? Max!
It's a beautiful baby boy.
It's a girl. It's a girl. It's a
Right, I'm going to give you something to help you to deliver the placenta. Vicky Penhale, can you get me a plastic bag?
For the baby?
No, for the placenta. Once it's delivered, I need to check that it's complete.
Right, ambulance is here, Doc. Ready whenever you are.
Thank you very much, Morwenna, and well done. You did very well. Right, well, the hospital will monitor you for the next 24 hours. How are you feeling?
I'm all right.
Well done. You did very well.
You all right?
Yeah. Oh, you worry too much, you do. Oh, look at her.
Oh, my darling.
She's beautiful. Thank you, Doctor.
Congratulations.
You handled that really well.
Cheers, Joe.
Thought you'd panic.
I'll bet that wasn't part of a birth plan, was it?
No, I'd rather she had it in the hospital.
I didn't have James in a hospital, though, did I? And the pub wasn't exactly part of my plan, was it?
Yes, that was unfortunate.
No, it was just different. That's what made it special.
Placenta. You left it behind in the shack. It's in a blue plastic bag. The doctor will want to see it. Go on. What were you saying?
I was just wondering what happened to James's placenta.
I'm quite capable of parking on my own, thanks, Joe.
Janice?
Get out! Get out!
Don't shout at him, Martin. He's been a bit off colour all morning. Hasn't touched his breakfast.
Open the door!
I don't have anyone else.
What about your grandmother?
She's still mad at me for burning down her shed.
You have your final assessment with the GMC coming up. There will be blood. Thick, red, flowing blood.
The new series of Doc Martin continues next Wednesday night at 9. Speaking emotionally about the challenges and successes he's faced in his 50 years as Duke, Prince Charles, Inside the Duchy of Cornwall concludes tomorrow night at 9. But coming up next tonight, it's the ITV News.